My name is Murita. I represent Gweru Residents Forum. What we did in the organization is that we partnered with some our donors, which include the GIZ and the Danish Aid, who provided us with funds, and we managed to do some training of community health workers. We managed to train about 36 of them, community health workers. As Gweru Residents Forum again, we managed to donate some PPEs to City Council, which include the face masks, which also include the face masks, the hand sanitizers, as well as the other PPEs, which the council was in short of. Okay, for residents, I can say, as Gweru, from our point of analysis, as Gweru Residents Forum, we can say that most of the residents are into informal employment. Like me and my director, we used to do some community interviews, maybe sometimes at night, and we see that some women and youth used to go maybe up to 11 p.m., up to 12 a.m. selling their products in Mutapa, in Ascot, and in Mkoba. And that was a very tough period, because given that the council, the local authorities, most of the local authorities, when the COVID-19 started early 2020, the council were instructed to do some clean up campaigns, and we saw the Gweru City Council removing those markets which the vendors used to sell the products. So it was a bitter pill to swallow for the residents. And from some of our interviews that we carried out, we saw that most of the residents were complaining that they've run short of their sales, and their consumption levels of food was very few. And these are some of the challenges. And also adding on that, the financial capacities of residents were eroded, because they had very few income generating activities that they used to carry out. And also coming to the level of council, they used to fail to residents, fail to obliging in paying their bills to City Council, because they had very little income, and that also resulted in the poor service delivery from the City Council side. One of the biggest interventions that I can talk about is that as Gweru Residents Forum, we managed to invent an application which is called the GSIT app. The application is not yet being in use, like what the mayor already said at the time, that it is now being synchronized with the council billing system. And one of major elements of this application is that it allows a citizen to manage and citizen to cancel interaction at real time. So we managed to design this application after we have noted that there was the engagement between citizens and council, in as much as service delivery is concerned, was very poor. So we managed to bring up this app, especially during the era of the COVID-19, noting that gatherings were were not allowed, and you find out that sometimes citizens have to go to budget making processes, and some of the citizens couldn't make it. So in order for them to participate, what you call e-participation or e-democracy, we managed to develop this app, and the council, they welcomed this app. But at the level of the citizens, we did what you call the human-centered design, where we launched the app to them, and they accepted it, though it is not yet being in use, but citizens have welcomed this development. Yes, our first target is Gweru only, but the arrangements which are there is that if there are other local authorities who are willing to take this up, they can, provided that they will make MOUs with organization, and maybe together with the Gweru City Council, because the app is now being honored by us as Gweru Residents Forum together with the City Council. So for other local authorities to use it, they have to make an MOU with Gweru City Council and GRF, so that they can also use the application. That is, if they are willing.